Low back pain is generally considered the bread and butter in chiropractic because it's the majority of the work that we do is treating people with some degree of back pain, specifically lower back pain. And back pain can come from a couple of different sources. Sometimes we'll see it from lifting, heavy lifting, or poor posture, which also includes frequent bending or sitting in a bad way, some degree of fall or trauma. It could be arthritic change or degeneration of the spine, and occasionally it'll be from an organ as well, but that's not very common. Most of the time, lower back pain comes from either a sprain or strain from overuse, structural problems associated with maybe a fracture, injury, or prolonged poor posture, or some degree of a disc problem. These are the most common ones we see. And the real contributing factor is our posture. And it's constant imbalance and compensation associated. So if I'm always on a phone like this, my back is compensating. If I'm always sitting, I'm compensating. If I have an injury to a leg or a foot, I'm moving in an unbalanced way. And this compensation, both from the front, you can see here is a curvature, in the spine, but also from the side. We call this sagittal plane deformity, where the lordosis and kyphosis of the back have become lost. And over time, this will lead to degenerative change and be the primary contributor to back pain. Sometimes we remember what we did, but most of the time it's like, I didn't do anything different. I just bent and twisted and the back pain came on. It's usually because of some compensation, some long-term problem. Now, when we talk about back pain, we also talk about how do you get rid of it? What's the most effective treatment for back pain? So when we talk about evidence for treating back pain, this is just published literature from around the world and in many different publications. What most other countries will do, because it's a socialized medicine, they try to find the least expensive, least interventional, and the best response path for a patient. And what that finds is the first line of treatment is staying active, stretching, exercising, maintaining your weight, eating well, sleeping well. These are all different activities that we know we should do. But once the problem is there, the second line treatment is hands-on work. Massage, chiropractic adjustments, any sort of movement patterns specifically built around engaging muscles, joints, and nerves to decompress, less injury, less irritation, and more overall function. We can also see from this was published I believe in 1992, that shows the different levels of intervention for back pain, what works and what doesn't work. So you can see on top green, exercise is a big one, spinal manipulation or spinal chiropractic adjustments are also in the green. It's really noting here that in the orange, it says antidepressants are listed there, which is even above steroid injections or opioids, which is I found that a little surprising there. But really hands-on work is what works the best. Exercise, movement of the tissue is what works the best, not drugs, not surgery. We also know that acute low back pain, this was published in 2021, where they looked at clinical practice guidelines. The dark blue are the things that have the highest quality evidence, and those are movements, exercise, balance, and chiropractic adjustments and joint movement patterns. The medium blue are massage, soft tissue, and active education strategies. But these are for acute low back patients. The number one there is movement and chiropractic adjustments. And if you have something else that works for you, great. But the data shows that if you have a lower back, the safest, most effective, and the quickest result is going to be by moving the joint either on yourself or having a professional assist you.